Welcome to Crisis in Perception. Today, we're diving into a really powerful but really wrong idea that a pandemic is a great equalizer. We're going to show you how a virus doesn't spread randomly. Instead, it follows a predictable and deeply unequal path that's already been paved by the very way our society is designed. You probably remember this, right? At the very beginning of the COVID-19 pandemic, this phrase was everywhere: the great equalizer. And it's a comforting thought, isn't it? This idea that we're all in this together, facing the exact same risk. But was that really what was happening? Well, not even close. The data and, frankly, centuries of history tell a completely different story. It turns out a pathogen's spread isn't some matter of biological luck. It's predictable. It's almost as if it's following a roadmap that we designed. A virus doesn't just see a population, it sees the fractures, the divides, the very architecture we've built. Okay, so to really break this down, we're going to walk through the system piece by piece. We'll look at its design, the incentives it creates, the outcomes it produces, and why this whole thing just keeps happening over and over. Then we'll connect the dots and get to the real crisis in perception here. All right, first up, the system's design. And this is key. Think of our society less as a random crowd of people and more as a detailed blueprint, a physical architecture. For a pathogen, that blueprint is basically a roadmap, showing it exactly where to go. So for the affluent, density looks like this. It's what we can call upward density. They build up. Think skyscrapers, spacious apartments, penthouses, lots of private space. Money literally buys you elevation and distance, creating a personal buffer zone that's incredibly effective at keeping a virus at bay. But for the impoverished, the geometry is the total opposite. It's not upward density, it's inward density. People are concentrated inward, packed into small, crowded homes. You've got multiple generations sharing just a few rooms. How do you isolate in that environment? You can't. It's physically impossible. And the numbers here just make it crystal clear. We're talking about two completely different realities existing in the same city. One design offers a sanctuary, a private retreat from the virus. The other, it's basically an incubator. Okay, so besides density, there's another crucial part of the system's design: hubs and bridges. Hubs are key locations, right? Airports, grocery stores, and bridges are the people who connect them, like transit workers and other essential employees. Now, these connections are the lifeblood of our economy, but for a virus, they're superhighways, creating these perfect pathways for it to jump between otherwise isolated parts of society. So you have this physical design, this roadmap. Now let's talk about the choices people get to make within it. Because, as you can probably guess, those choices are anything but equal. If you're wealthy, the incentive is pretty straightforward. You have the ability to buy what's essentially plague insurance. You can get out of the city, head to a second home, have everything delivered. You can effectively pull yourself out of the network of risk altogether. But for essential workers and the working poor, there's no good option. They are caught in this impossible double bind. Choice A: go to work, get exposed, and risk your life. Choice B: stay home, protect your health, but face eviction, hunger, and financial collapse. Let's be honest, for millions of people, that isn't a choice, it's a trap. So you have this unequal design and these unequal choices. The outcome isn't a surprise, it's not random at all, it's perfectly predictable. It creates what is essentially two different pandemics running side by side in the very same city. And the data from the US during the first wave is just staggering. People of color died at rates 2 to 3 times higher than their white neighbors. And let's be absolutely clear, this isn't about biology. This is a direct result of the social architecture, that inward density and that double bind we just discussed. 300%. Just let that number sink in. During some waves, the most impoverished counties had death rates 300% greater than the wealthiest ones. This is how a pandemic becomes a pandemic of poverty. The virus itself might be indiscriminate, but the society it moves through is anything but. And maybe the most unsettling part of all of this, none of it is new. This isn't a one-time failure. These patterns are baked into our history. It's a system that persists, repeating the same tragic script over and over again. I mean, look at this illustration from the 1625 plague in London. What do you see? The wealthy are fleeing in their carriages, while the poor are left behind to die. Sound familiar? The wealthy flee, the poor are trapped. It's a pattern as old as cities themselves. You can track this through history. The plague of Athens, cholera in 19th century Naples, the 1918 flu pandemic. It's the same story every single time. The disease follows the fault lines of inequality that were already there. And why does the system persist? Because during the calm between the storms, we never actually address the underlying vulnerabilities.
And of course, this system of epidemic inequality doesn't exist in a vacuum. It's deeply interconnected with our wider economic and political structures. Just look at a for-profit healthcare model. Its goal isn't public health, it's profit. This creates huge preventative care deserts in poor and rural communities. And when high-quality insurance is tied to employment, it leaves the very people on the front lines, the low-wage essential workers, with the least protection, often because they simply can't afford it.
So this all brings us back to the central question, to the crisis in perception. What is it that we're fundamentally getting wrong here? Why do we keep falling for that myth of the great equalizer when history tells us the exact opposite over and over again? Here's the crisis. We're conditioned to see health as an individual problem. It's all about my choices, my mask, my risk. This blinds us to the systemic reality, which is that health is a collective we problem. Pandemics aren't equalizers. They are inequality amplifiers. And your personal risk? It's largely determined not by your choices, but by the social architecture you live in. So let's put it this way. Systemic inequality isn't just a side effect of a pandemic. It is the very blueprint the disaster follows. It's the fabric that allows a biological spark to become a raging social firestorm. And that really leaves us with a critical question. If inequality is the blueprint for disaster, what does it actually mean to build a safer world for everyone? Crisis in Perception examines how systems shape belief and how better tools help us see clearly. This project is free and publicly accessible. If you'd like to support the time, tools, and research behind Crisis in Perception, you can become a supporter on Patreon. For a shorter visual overview of this topic, see the mini explainer linked in the description. If you enjoy this kind of systems-level analysis, please like, subscribe, and comment with books or topics you'd like us to explore next.